let's talk about the next really important airway technique, but bag valve mask. So when bagging fails, how do we bag better? Or better yet, how do we bag awesome from the start so that it doesn't fail? Of all the airway techniques we'll talk about today, this tool that oxygenates and ventilates is the most important. This is what will save lives much more often than a laryngoscope and an ET tube. So BVM, classically, you were taught this C and E grip, which was kind of problematic, right? It's very hard to get a good seal. It's sort of air leaking out on the sides. So then they said, well, if that doesn't work, if you have enough people, do a C and E grip still, but do it with two hands. Now we're teaching the thumbs up technique. Why this is the best is because what it frees up is all 8 of your fingers to get under the jaw and pull the jaw up into the mask. What we want to do is pull the jaw into the mask, not necessarily shove the mask down onto the face. With my 2 thumbs up resting on both sides, I have nice equal pressure of the mask over the face, and I have all these fingers free to give a nice jaw thrust. Now, many people say, we just don't have the people power for this. We only have one person to bag a patient. And I will argue, unless chest compressions are being done, if bagging isn't going well, nothing else on a scene matters. The only thing more important than oxygenating and ventilating my patient is performing chest compressions. Once you know you're oxygenating and ventilating, now you can move on to other tasks on the scene. So remember, pull the mask up and in, pull the jaw up and into the mask. Don't push down on the mask into the face. Now, if you're bagging someone and you still are having a hard time, you can pad under the head, get them in that sniffing position. That can improve your airway dynamics. Don't forget to use an OPA because the biggest failure of a BVM is lack of using an OPA. If those things are optimized, then you can rotate the head a little bit. So keeping that nice jaw thrust, rotate the head over to the left, then maybe try rotating it to the right. It doesn't matter which side you try first. The idea is this can actually displace some of those redundant tissues that may be obscuring the airway. So if you can't bag, make sure you bag better. Optimize the technique that you're doing. Let's sum this up. Redo your jaw thrust. Get above the patient for the best force and positioning. When you put the mask on the face, make sure you rock it open, you roll it onto the face and stretch the cuff, and then pull the jaw up into the mask. If you can, get the patient sitting upright a little bit. This can improve pulmonary dynamics. So if someone's on your gurney, all the better. BVM is a difficult skill and you may need an experienced provider. If I'm in a room with a patient with low oxygen saturation who's being bagged, I go straight to the head and I hold the mask. And you can run the scene from the mask, but the mask seal is the most sort of difficult skill. Once you have ensured adequate oxygenation and ventilation, you can pass that job off to someone else, coach them, and make sure that they're continuing to do it well. And remember, the most